Welcome back, viewers. That was Tobago in Focus. And at this time, viewers, we are going to be heading on over into that recording with Dr. Pelham McSween, chiropractor, and we'll discuss the importance of chiropractic. Welcome back, viewers. We are here today at the Pelham McSween Memorial Chiropractic Center. And this is where Dr. McSween is located. For those of you who know, he is a chiropractor, and today we're going to have a nice one-on-one with Dr. McSween. Let's go. Morning. Hi, good morning. Good morning, Dr. McSween.
Good morning.
How are you?
I'm good. I haven't seen you for some time.
It's been a long time.
Oh, it's a pleasure here.
All right. Could you tell our viewers, in terms of chiropractic care, what is chiropractic?
Okay. Chiropractic is the art, science, and philosophy of vertebral subluxation. A vertebral subluxation is when any segment of the spine moves out of place in this relationship with the bone above it or below.
Okay.
And it is about a hands-on approach to healthcare, where you use your hands to move the segment of the spine to relieve nerve pressure, therefore decreasing pain, discomfort, numbness, swelling, and so forth.
Is this the type of skill one can acquire from watching YouTube videos?
No. Impossible, virtually impossible. Remember, I can walk. I told you I had an injury. I jumped out of a plane, my parachute didn't open. And as an MD, having had that experience and going to all my MDs, my neurologists, etc., they did not know what was wrong with me until I found a chiropractor that they sent me to. That was the last straw because I was due for surgery. And the first day the chiropractor, I couldn't feel my legs. The first day the chiropractor put his hands on me, I felt my legs. I thought some was amiss. Because
it was magic.
I thought it was magic, trust me, because I had to drive to my bathroom to get to the toilet, the whole bit, and it was an experience I want no one to experience. And so the guy that put me back on my feet is a bona fide chiropractor. Went to school, got his doctorate in chiropractic, and he showed me, got to use those X-rays. Without them, you're in trouble. So you can't look at YouTube or wherever you want to look at, or go to the backyard of somebody else and see somebody do something and say they're a chiropractor. You have to have that doctorate in chiropractic to practice chiropractic.
Now, I know sometimes persons refer to you as the man who does crack back.
Yeah. I've gotten accustomed to it. I used to feel bad about it before, but I don't anymore.
Right, but it's important for them to note that it's not about cracking the back.
No, not at all. You adjust the spine. You don't crack anything.
Although we hear the noise.
Oh yeah,
we hear the sounds.
You heard the sounds.
We hear the sounds.
But yeah, you don't crack anything. You adjust the bones. You adjust the spinal column. You adjust the vertebral bodies from the base of your head, which is atlas, all the way down to sacrum.
And what is the aim? At the end of the day, what is the aim for chiropractic care?
All right, the aim of chiropractic care is to get you well and to remove tension on the nerve that is being caused by the disc and lots of times the bones as well, the vertebral segments.
Okay, so today we're going to be chatting with a couple of your patients, and you're going to give us a nice walk through in terms of how you treat your patients and what you look for.
Okay, yes.
Okay, let's go. So Dr. McSween, it's important for our viewers to note that you operate with X-rays.
Yes.
How important is that?
Vital, because it is what that tells you where the bones have moved to. Nothing else does.
Not the tips of your finger, not intuition.
No intuition.
Years of experience.
Yes. No. Well, without the X-rays, you can't function as a chiropractor. It's impossible. It's just like if you're a cardiologist, a nephrologist, any one of those guys, they must know and get information essential to assist and help the patient. The nephrologist need, of course, all kind of information on the kidneys. The cardiologist need all kind of information on the heart. The chiropractor needs all the information he can on the spinal column. And the only thing that provides that is the X-ray and the MRI.
Okay, so tell us what we're looking at on the screen.
We're looking at, I normally must request 3 X-rays of the cervical spine. We're looking at a base posterior X-ray on the left, and we're looking at a lateral cervicals. So they're both cervical X-rays, and the other X-ray that goes along with this is what is referred to as an open mouth. An open mouth X-ray is essential because you're looking at atlas and axis down the cervical spine. So this here is atlas, this here is axis, and then you have C3, C4, C5 down to C7. The reason why you want an open mouth as a chiropractor is because you're looking for laterality, and that is where is axis and atlas located and the relationship that they have. In this film here, which is of Joe, the spinous process of axis has moved to the right. And therefore, there's a space between atlas and axis that's called the ADI space. You see it on either side. This is the odontoid process of C2, and it goes up into axis. So you're looking at this space here. You can see really from this space, there's a discrepancy. You can see that the space on the left is very different to the space on the right. And of course, looking at the spinals from C2, you know there's rotation. So C2 is rotated to the right, C3 is rotated to the right, C4 is also rotated to the right. So that X-ray there is essential. And then this here, which is the base posterior X-ray, you want to see further down. And so you could identify the bones that are out of place. So C6 and C7 are certainly rotated right as well. And the lateral view tells me that Joe has what is referred to as a military neck.
Which means?
A military neck meaning it has lost its curve. There's what is referred to as a lordotic curve, which is like a C. And you can see his neck is straight.
Yes.
So this X-ray identifies what is referred to as cervical spondylosis. Yes?
Based on the X-ray,
Yeah.
based on what we're seeing on the X-ray, is it that Joe was born like this? Or did this happen as a result of an accident, injury?
Well, this looks like post-traumatic. It looks like he has been some trauma to the cervical spine. Maybe been an accident and so forth. And that would cause this problem here, where there's a tightening up of the ligaments and muscles that brings about this. And then we're looking at osteophytes at the end plates of the vertebrae. Like this here is a osteophyte. There's an osteophyte. There's a little jutting out here of C4, and there's an osteophyte up at C6, the superior end plate of C6 and so forth. So I must identify that to understand his symptoms as well, because these osteophytes would cause pain and movement of the neck and flexion of the neck, rotation of the neck, and bending of the neck. Yeah. So these are the exercises that I take my patients through to identify and localize the problem.
Can you tell based on the X-ray how long?
Oh yes, certainly. He has had this, I would say, 15, 20 years. He has had it, maybe a little more. And I am basically looking at destruction.
Okay.
And that came about from the trauma he had experienced. Usually a patient comes to me with this. The first thing I ask, have you been in an accident, an auto accident in particular? Mm-hmm. And then you have all the other questions like growing up, what he used to do, carry water on his head, and this kind of stuff. And if he has had any other mishaps after that, he has slipped and fall. So all of that affects this. And from this now, he would get tingling in the fingers, numbness, numbness and pain in the elbows, in the wrists, in the shoulders, the side of the neck.
Ms. Alfred, good morning.
Good morning.
And it's really nice of you to take the time to chat with us today. All right. Now, you've been coming to Dr. McSween. Let's start with why you started to come to Dr. McSween. What were some of the symptoms? What was happening with you that made you decide, hey, I think I need to see a chiropractor?
I have been having a lot of problems with my legs, especially this right leg. Pains. Sometimes you can't walk. Pain from the hip.
No.
Yeah. So I was attending a doctor, and there was a nurse there who, well, she worked with the doctor, but she knew of Dr. McSween. So she advised me that she thinks I should come to see him because I wasn't getting any better.
Okay.
You know? So eventually I found him, and that's quite about a few years.
A few years.
Yeah. And since then I've been coming because I am able to walk. I'm able to do a lot of things now without pain that I couldn't do before.
Let me ask you, what did you think it could have been initially?
Well, I didn't even know what to think. It was just the legs, and I was having problems in moving them. They were getting swollen and painful.
Okay.
Right. I'd been going to the doctor. He would give you medication, but it will go and it will come back.
Okay. I know some people think, oh, it must be gas.
No.
It's probably age. And we start to self-diagnose.
Well, I didn't think about age because I was pretty young at the time. As you see, I'm still young.
Still young, that's right. I see your husband agrees. Yes.
Yeah. And that's a few years now, you know. And I'm still coming because I am satisfied, totally satisfied.
Okay.
With my movement, with everything. I mean, now and then it will take in a little,
Right.
but nothing to complain or to lay you up, that kind of thing.
Okay. Now, Penny, what made you decide to start coming to Dr. McSween?
Actually, I was referred by a previous doctor, who the Lord Father. Yeah, I went to her for another issue, and then she noticed that she said, "You have problems with your spine." I said, "No." She said, "But something definitely is not right here. It looks like it's a bit curved." And then she said, "I'm going to refer you to a chiropractor," and she sent me to Dr. McSween.
So you did not even realize that the spine was curved?
No. I actually went in to get an echo done.
Okay, and she noticed this?
She noticed this during her examination.
But as a result of this curved spine, unnoticed, what were some of the symptoms that you experienced?
At the time, I wasn't experiencing anything major, but I did observe like my back, the upper portion. I would be getting like pains depending on what I do and how my daily activity was. And then Dr. McSween would have sent me for Xrays, and then from that he started to treat me, you know, throughout, and he has been treating me for 10 years. Basically, my daily day-to-day activity creates my problem to some degree because I think I have a bit of spondylosis, all right, and then sometimes my neck also gives me problems. You know, I think I was in an accident a couple of years ago, and you know, maybe the whiplash or whatever they call it. You know, so with all of that, from time to time, he treats me when I overdo it. And
She's honest. She's
because
honest.
we do sometimes ordinary housework, sometimes you're lifting things that you're not supposed to be lifting.
Or lifting it inappropriately.
Right, that would happen. He accuses me of lifting it inappropriately.
Yeah,
sometimes I really do. You know, you just do it.
Right, in the interest of time, I know. All right. So, were you in any type of pain at the time?
Well, as I said, at that time, it wasn't particularly noticeable. All right, it's just, you know, the previous doctor, Dr. Jack, they said that I would just age and I need to manage it.
Right.
So, you know, sometimes you discover something and then you take care of it one time. You don't wait 10, 15 years down the line, and then you go look for a chiropractor, you treat with it. So I've been under his care more than 10 years.
I have analyzed Joe's films. Previous to this position he's lying on, I would have put him on another table, stretched him up a bit, give him a back massage a bit to loosen him up, and then put him on this table. And so I'm going into Joe's neck. I'm going into C1 and C4 in particular to move them. Right. Relax your head. Just leave your head in my hands. Leave your head in my hands. Don't help me. Good. I've moved it already.
Yes.
You heard it?
I heard it.
Okay.
I heard it.
And I would stretch him a little bit. So I'm going to go into his neck on the left side, because the segments of the vertebrae that I spoke of, they all rotated to the right. So I'm moving 2 bones down here from right to left, which is C5 and C6.
Yeah.
Now, if you look at my hands, you see my hands are in particular places.
Yes.
All right. My left hand is to lend stability to the head, and the right is to move the segment. I'm going to move the segment. Good. So the segment is moved.
Now, I'm just asking here, is Mr. Joe in any pain?
No.
That's important to note.
No, Mr. Joe is not in any pain. And then I'm going to come here. I'm going to move T1 and T2 and T3 to the left side of his neck. Drop your hands to me, Joe. Okay. And that's done. Now, he's been with me so long, when he comes and I check, you may not hear as much sound there.
But the first few times that he came...
Oh my God, ask him. A lot of noise in the head. All right? Relax.
Okay, folks, we just spent part of our morning chatting with Dr. McSween about chiropractic care and the importance of it, the importance of having a licensed, trained chiropractor put their hands on you. Now, it's not just about looking at YouTube videos or doing something behind the building, but it's about a recognized, licensed chiropractor treating and attending to your body's needs. So, we want to thank you for joining us, and lots more coming up this morning on the Tobago Updates morning show. So, share the live, share the live, share the live.